You're listening to The Mountain Spirit, a podcast of Christian Appalachian Project, where we share inspirational stories of faith, service, and compassion. I'm a firm believer that we're all connected by our shared humanity, and that finding that intersection, sometimes this means having a conversation. And today, we get to hear from Tom Vicini, President and CEO of Operation Unite. It's a nonprofit that uses a three-pronged comprehensive approach to combat substance abuse and misuse in southeastern Kentucky. The fallout from this issue has been felt far and wide, not just in Kentucky, but nationwide. Certainly, Christian Appalachian Project has seen a rise in grandparents raising grandchildren since the opioid epidemic tore through families in the region. But groups like Operation Unite are working to proactively address this issue, and we are so excited to talk to Tom today. Hi, Tom. Welcome to the show.
Glad to be here today. Thank you for giving us the opportunity.
Well, we're looking forward to sharing with our audience what you all do, the fantastic work you all do through Operation Unite. So before we get into the work that you do there, can you set the stage a bit and kind of paint the picture for our audience to help them understand what were the factors that contributed to needing an organization like yours in the first place?
That's a really good question. Back in around 2003, Congressman Rogers had read some articles in the Lexington Herald that was talking about the drug addiction problem that was happening in southern and eastern Kentucky in the coal mining fields. And he looked at those series of articles, and people were dying from overdoses. There was corruption in government. There was all kinds of bad things going on, and addiction had just taken over in the area. So he said, we got to do something about that. So he gathered a bunch of advisors in law enforcement and education and health field and said, how do we approach this? So he came up and said, well, we can't just do it from one area. We've got to have a comprehensive effort to really deal with this problem. And you know, what really happened at first is I think a lot of people got addicted to opiates because they didn't have a clue how addictive these substances were going to be. You know, the oxycodone came out, OxyContin came out as a prescription drug prescribed by doctors that was going to help with pain and in the coal mining industry and the hard work that people in southern and eastern Kentucky do, there's a lot of pain involved. So this was supposed to be a help for people in pain. Well, nobody really knew anything about addiction. The only addiction people were familiar with in this area had to do with alcohol. People knew about that. Alcoholics have been around, still the most abused drug in the world. We know that. And tobacco. So nobody would have ever thought that taking a prescription drug would cause this kind of addiction. So it caught everybody by surprise. And then not only was it easy to get because it was being prescribed, it had a major euphoric effect. So it was pleasurable to use too, and people found that out. So, I mean, with easy access, and they really enjoyed it, and it was doing what they wanted it to do and more, people became addicted really quick. So that led to all kinds of corruption and street selling and just everything. Before you knew it, it was just totally out of control. So nobody really knew how to handle it. I was a mayor of a small town in Harlan County, and I saw what it was doing to my community. So I approached Operation Unite about going to work for them because our law enforcement folks had not a clue about how to deal with this situation. So that's how I got started with Unite, and that's how the Unite got started. Congressman got these folks together. They started Operation Unite in 2003. With the goal of really addressing this problem from three areas.
So tell me, why was it important to see this more as a health care crisis? I know you have a component that works with law enforcement, but why was it important to see that not just as a criminal justice issue, but as a health care issue and a community issue and a holistic issue? Why was that important to the community?
Well, you know, it started as something that was supposed to really be a cure or at least an aid to a health problem. So it was not only affecting the individual user, but families, because as people became addicted, it was getting families separated and causing lots of domestic problems, lots of robberies, burglaries, and so forth. It became a real community issue, and really and truly, just looking at it from that standpoint, from a health standpoint, people were really getting addicted without really trying to. Now, after a while, people knew about the euphoric effect. They knew that it, would give them a major high. So a lot of people did start using it just for the high. But it really was something that was intended to be something that was a health proponent. It's something that was going to help people. So we had to look at it in a situation where you can't go in there and just put everybody in jail, because that's not going to solve anything. But you've got to have some enforcement, because it can't be wide open. And then you had to come up with a way of helping people that were already addicted. We had to have some resources available. And back then, there were almost no resources available. But we had to find ways of helping them to get the help that they needed. And then we had to educate people about what the problem really was, and that, you can't continue to use these drugs except even sometimes as prescribed, because of the addictive nature. So there was so much education that needed to come about.
So you all have a three-pronged approach that has some of those components. Can you tell me about those three focus areas? Because the other groups that you all partner with comes out of that, and what the foundation of Operation Unite, your mission statement, your vision for where you all are trying to go in southeastern Kentucky.
So in the early years, law enforcement was a major emphasis of Unite. I will say that. And a lot of people still remember us for those roundups, is what they were called, drug roundups. Actually, the second day I worked for Unite, I went on a drug roundup with our law enforcement folks. I wondered why I was there, because I wasn't a law enforcement person. I was a little bit more than a little bit nervous. But we went on this roundup actually in my home county of Harlan, and I was there because we were trying to make an intervention in the community to help people. It wasn't all about just taking people, putting them in handcuffs, locking them up in jail. It was about telling them that there were different options, and that we understood that addiction wasn't something that really they were looking for or they understood anything about. It was something that they needed help with. So I was there to tell them about drug courts and the opportunities, telling them how they could possibly get into a drug court program, telling them about treatment, and that Operation Unite was the only way you could get treatment paid for at that time. We were paying $5,000, and still are, for people to go into long-term treatment. So we were giving them what we called vouchers if they wanted to go to treatment. We were looking at options to get people help rather than just incarcerating those folks. And that's what was really needed. And another thing that we did, and I fell in love with Unite the second day, because my job was to hand out flyers in the community saying, let's get together and meet as a community. 2 days later, we met 2 days later in a church in Everett, Kentucky, near Everett. And we told them the theme of that meeting was, let's take our community back. Let's help those people that are addicts. Let's get rid of those people that don't want help and just want to take advantage of the people here, those dealers that really that are not involved in this community. Let's get them out of here, and let's educate people about how to stay drug-free and the addictive nature of these substances that they're using. So we were the first people I know of that did community policing the way it was supposed to be done. So I just thought this is exactly, it was in line with me as a mayor and as a person that's been involved in my community all my life. I'm a Little League baseball coach, and started a basketball program for the kids in our community, and worked as a volunteer all my life. it was right in line with everything I wanted to do. So I came to work for Unite so that I could actually help people in a problem that was just destroying families.
Stay tuned. We'll be right back.
Did you know on this Giving Tuesday, families in need in Appalachia are counting on you? Don't miss this opportunity to provide nutritious food, warm clothing, critical home repairs, and Christ's love to people living in unimaginable poverty. Visit christianapp.org to give today to help children, families, and seniors in need.
So you work in general with youth, but Operation Unite also has a lot of youth components. Can you talk a little bit more about why that's important to build into the next generation?
That's such a great question, and it gives me an opportunity to be something that I've been preaching for 10 years now. Unite, as I said, focused a lot on law enforcement at first, and then there was so much emphasis too on treatment, and we knew so many people, all of us have somebody that needed help from addiction. So it was really important to get people the help they needed. But when it came to prevention, very little effort was going forth in prevention 10 years ago because it's so hard to measure sometimes. There's so many variables and so many factors to figure into why somebody does not use drugs. So I talked to Congressman Rogers about it then. I said, we really need to put an emphasis on prevention and education. So we really started back then, but now it's taken hold, and we have people. Last month alone, when I became president in October of 23, created a prevention team. And we showed programming or presented programming to over 10,000 children in October and last month, over 10,000 in that month alone. Well, prevention is just the key. We've got to, as long as we continue to just incarcerate people or to send them to treatment, we're not going to really solve the problem because we're not stopping the creation of new addicts. So our focus as an organization has really become prevention. New addicts are being created today is through vaping in schools and out in the communities. Kids as young as second, third graders are vaping. And unfortunately, their parents don't know any better. A lot of them think that they're safe and it was an alternative to smoking. Well, there's not a vape out there that doesn't have nicotine. So those kids are getting addicted to nicotine early. And, and as usually happens with young adults, they've experimented with vaping marijuana. So some of them are sitting in schools doing that at times, and they can vape other substances like cocaine, meth, and all those other things. So we see that as trying to get a brand new marketplace for addiction. So we've got to educate those kids. We do those programs. We do one on internet safety because that's where kids can get in a lot of trouble posting pictures and doing things on the internet that they shouldn't. We do anti-bullying programs. We do one pill can kill, which has come about now because of fentanyl. Fentanyl is being used in so many substances. I mean, if you get a pill off somebody off the street, you don't know what it has. You might think you're taking a Xanax or a pain pill, and it could have too much fentanyl in it and kill you on the spot. That's happened quite a bit lately. So the drugs are more dangerous now than ever before in history. And we have to educate these kids. We've got to tell them we've got to create a culture where it's not cool anymore to use drugs, where they look at people that are doing that and try to help them to get off drugs. But at the same time, we've got to create a culture that says, I'm not going to ruin my life. So we're pushing healthy lifestyles. You can't go in there and scare these kids to death because they don't want to be preached to. Tina. What they want is to know, and I tell our people before they go out every week, engage with them and let them know how valuable their life really is. Let them know that they are created in a special way by God with purpose and value. And that's what they need to understand, and that they cannot feel that God-given purpose unless they have a clear mind and a clear heart. And we are really pushing those things, the positive value of staying drug-free. So we're really working hard on that, and we're only getting started because we're trying to expand. We have 34 counties right now. We would like to go all the way across the state because, I love kids in Paducah and Bowling Green, just like I do in Laurel County and Harlan County. So,
Yeah. Yeah. What do you think one of the most challenging things is about the work you do?
well, it's heartbreaking at times. I remember when I first started, I was very involved in the voucher program trying to get people help. And it seemed like 9 out of every 10 people, because we couldn't get them into treatment fast enough, 9 out of every 10 would change their mind before they went. And addiction is such an evil animal. It really is. It changes the whole way they look at things. It rewires their brain. And we've seen so many people die from it. So I have lost so many people that I know of that have we've worked with and tried to help, and it's something that they have to deal with the rest of their life. You can say that they're clean and they may not have used drugs for 2 years or 5 years or 10 years, but they're still susceptible to going back to it. So it's the only way to keep from being a drug addict is never get started, because it has such a grip on people. That's one of the things. It's been really, really difficult to get the funding that we need to do the kind of work we want to. We're funded by the state, and we have to go up before the state legislature every 2 years and get funding. And that's a difficult battle because, again, when you look at our organization, we are unique in every way. There's not another organization like us. We're a nonprofit, and all our services are free. We don't charge for anything that we do. And I've resisted the temptation to do that because I want people to see us as somebody that's on a mission to save lives and to change the culture. I don't want them to think of us at all as somebody that's coming in there to try to make a profit. Our gift is seeing people's lives transformed and changed. That's the way. That's the only way I want to do it. I want them to see us as an organization that is there to help them.
So I'm sure that you have partnerships just like we do that help meet the needs in our service area. Can you share about some of the partner organizations that you all have worked with and how you all are working together to make a difference in those communities?
Partnerships are key to our success. Of course, we work with a lot of treatment facilities. As I said, when we first started, there might have been 2 or 3 treatment facilities in the state of Kentucky. Now there's several organizations that have multiple treatment facilities all across the state of Kentucky. So we partner with them in our voucher program. People that want to go to their facilities apply for vouchers, and we pay to get them into treatment. So that's one way we partner with. And there's certain guidelines and things that they have to meet. And we believe in long-term treatment. United does. We consider long-term treatment 90 days of inpatient treatment or more. A lot of people don't believe in that anymore. There's a move to where there's just like 30 days of inpatient treatment and then intensive outpatient treatment. So we're trying to adjust to the times, but at the same time, we want people healthy. We want people well. We don't just want to try to do a quick fix with anybody. So we work with treatment facilities. We work with organizations like Volunteers of America. They're one of our big partners, and they do a lot of community events and a lot of things. They have treatment. They have facilities that help mothers that have children so that their children aren't separated from them. They have recovery community centers that we help sponsor with those. Volunteers of America is a great partner. We work with all local law enforcement agencies. What we try to do now, instead of arresting and having drug roundups, we provide them resources to build federal cases. So 3 of our 4 law enforcement agents work with the DEA. Their job is to work to prevent drugs from getting into this area, not on the street level. If there is street level work going on, we can assist them in some ways, but for the most part, that's not what we do anymore. And then again, our biggest partners are like family resource centers and schools. We work with them all the time to do presentations. And I can't leave out the major one is our community coalitions. We have a community coalition in every county that we serve. This is a group of volunteers that are basically a cross section of that community. It can be elected officials, it can be health educators, it can be folks from the school system, just citizens, people that have lost somebody to addiction or have somebody in. Everybody's affected by it. Excuse me. So we work with communities and we provide them with funding for prevention programming, education programming, and aftercare programming. We help with aftercare also that is specific to their community. So we're giving them funding and they're telling us what their needs are in that community. And communities are different in their needs.
Yeah. So I know that you personally serve the community in a number of ways. When it comes to leadership in the community, what would you say are the principles that drive you?
To drive me personally,
Yes.
love is first. I think when I graduated from UK more than a few years ago, I went home to my community and I saw, we lived in a small community, coal mining community, and I saw as coal mining left over the years or diminished, what a great need we had. And my first thing that I did when I went back is I saw all these kids that were on sports teams in schools, and these were the popular kids, and they were getting all the advantages. And so I started this basketball league for kids that weren't on any school team, those kids that weren't good enough to make those teams, because those kids might not have had the talent, but they were just as valuable to me as the ones that were. So I had them from kindergarten all the way through grade 12. We did that for 17 years. Then I got involved with Little League Baseball, and I've coached a Little League team for 46 years. I do that because kids need mentors. Kids need to know that there's somebody that really and truly cares about them, somebody that really values them for who they are. And so many kids have grown up because of addiction and things with parents that are disengaged with their children. And I don't want any child to ever feel like that someone doesn't care. I read this quote one time, and I wish I could remember who said it. It says, one caring adult can change the trajectory of the life of a child. And I believe that with all my heart. And I've seen it in action. So in my faith is the motivation of everything that I do. I mean, I believe we are called to be Christ to the world. And I try my best to be a good role model for people. And like I said, the one motivating factor that is love, because that's who God is. He's love, and He takes care of us, and He's rescued me from so many things. And I try to do the same with others.
Yeah.
So that's the motivation of all my volunteer work.
I love it. I love it. I know that there are lots of people that talk about Appalachia or talk about southeastern Kentucky, but they've never been to the region. What is one stereotype that you like to correct for people who think they know Appalachia, but you're like, man, if you really knew the people, if you really knew the culture, what's that stereotype that you would want to dispel?
That's a good one, because that stereotype still exists. I would say the thought that we're less than, and that bugs me. I think they think we're less than the rest of the country in intelligence. We're less than the rest of the country in culture. We're less than in so many things. They make fun of the way we talk, and they don't see the value of family that we do a lot of times. I mean, if you want to look at how people come together and help each other in the community, just you need to come to Appalachia and see how it works. I mean, I don't know of anybody anywhere that is in trouble that they can't reach out to their neighbors and have somebody help them. We're the most generous people in the world, probably, and people have very little resources. Sometimes there is poverty, of course, in our area, but what they have, they share. And you know, they're just such a good-hearted people. But we're not a woe is me poor people that don't have any intelligence. Some of the smartest people in the world have come out of these mountains. And, you know, the little community that I grew in, Lynch, we've had doctors and lawyers, we've had people working in Washington, D.C., we do today. And, you know, that are just as smart, as brilliant as anybody else in this country. So we're not less than. I'm not saying we're greater than either, but we are people just like they are, trying to get ahead and do the right thing.
Stay tuned. We'll be right back.
Your generosity has a direct and positive impact in the lives of people in need in Appalachia every day. It is the unwavering support of faithful friends like you that make this work possible. Many of our supporters are beginning to plan and envision what kind of legacy they want to leave to support the causes that are near and dear to their hearts. CAP is happy to provide a safe and easy experience for people to create a will and support CAP through non-cash gifts. Through our partnership with Free Will, CAP offers our donors the ability to create a will online and alter it at no charge. Our partnership with Free Will also includes their Smart Giving Suite, which allows donors to give through their IRA, donor advised funds, and stock online, in addition to creating a will for free. In recent years, Appalachia has faced unrelenting challenges, including the pandemic, inflation, and back-to-back natural disasters. You can make a life-changing impact and leave a legacy of hope in Appalachia. To learn more about non-cash giving opportunities, please visit christianapp.org/more ways to give.
What is your vision for Operation Unite? If you could look into the future in the next 25 years, what would you hope that the impact has been, or where do you see the organization in the next couple of decades? Where do you want to lead the organization?
Well, I would love to see us kind of work ourselves out of a job, but I don't believe that's going to happen. I believe unfortunately, there's always going to be drugs. There's always going to be, because they make them in labs now. I mean, you can't stop the production of all drugs. You can't stop all of them from coming in. You just can't. I would like to see us create such a culture where it's a rare occasion to see. I'll use an example. I remember as a kid growing up how everybody around me smoked cigarettes. I remember that. And it seemed like that was the thing to do when you got to be adults. I mean, you saw it on TV and advertisement, doctors smoking cigarettes, and cowboys and everybody else, it was the thing to do. But a big campaign like this came along, and I think it was really in the 90s, in the early 90s, anti-smoking laws, everything was created to really make it hard to smoke in places, and now there's most public places you can't smoke. So you don't see as many people smoking. Maybe in Kentucky, too many still do, but it's not like it was at one time. So it's changed the culture. That's what I want to see with Unite. I want us to help create a situation where people are more concerned about their health, to the point where they think it's really stupid to use a substance that's going to hurt themselves. Kids don't. One of the things that we appeal to kids about right now is how these drugs affect your looks and your overall performance. So we want them to understand that you may use drugs and you may get over drugs, but it can affect you, for the rest of your life. It can be something that's going to affect your health on down the road.
So tell me how it makes you feel to know that it's people in the community. I know, with CAP, we really depend on partnerships and donors and supporters. Many of them from Kentucky, many of them from outside of the state. But you all are doing work right there in the community with people from the community. What does it mean to you to see people from the community? You just talked about how people come together, but seeing them rise up to address these issues that are happening in your own backyard.
And one of the things that I've seen really obviously lately is that as I said, we have community coalitions. For a while, you were going to coalition meetings and you were having parents come there or grandparents come there to these meetings who had someone in active addiction. So they were coming there out of desperation. What can I do? I don't know what to do. I don't know how to get my child help. I've used up all my resources. I'm broke. I just don't. I'm at wit's end. What we're seeing now, and we're going to a lot of coalitions where like 10 people then, now they're 30 or 40 people are getting together every month, and it's people that just love their community. They do have a connection to addiction with someone, just like I said, about everybody does, but they're there because they want to change this culture too. So you see them volunteering to do youth programming. You see them volunteering to do things with the school systems. Just all kinds of events going on now to try to get the message across that we're really tired of this culture, this drug culture, and it takes every one of us to really make a change.
That's awesome. Tom, I know our time flew by. I'm already down to my last question, which we ask all of our guests. The mission statement of Christian Appalachian Project is building hope, transforming lives, and sharing Christ's love through service in Appalachia. Hope, transformation, love, and service. Which one of these resonates with you the most when you think of Appalachia?
It's hard for me to not combine love and service. I believe that because of love, we serve. I don't know how anybody can live this life and be happy or fulfilled unless they're serving someone else. As a coach, the first thing that I tell my kids every year is that be more concerned about your brothers in this dugout or your sisters in this dugout than you are with your own effort. Be more happy when they succeed than when you succeed yourself. Learn to do things to help one another. Every time that I come upon somebody that says, well, I'm just depressed, I'm about ready to give up, I can't win this battle, I say, go do something for somebody. Do something for somebody. If you want to be happy, do something for somebody else, because everybody has needs. And when we've got each other's back, out of love, out of unselfish love, not looking for somebody to come back and give us something back because we have done something for them, then we really create a world that's great to live in. So yeah, motivation out of love to serve others.
Amen. That ends our show today. Tom, it's been a pure pleasure. Thank you so much for being on the show today.
Thank you, Tina. I've really enjoyed talking with you. God bless you.
Thank you. Our guest today has been Tom Vicini, President and CEO of Operation Unite. We hope you've enjoyed the show today and that you've learned a lot and will check out next week's episode. Tell your friends to check us out too. You can follow the work of Christian Appalachian Project on all social media channels. And you can also find the podcast at wearecap.org/podcast or wherever you get your favorite podcast. If you like the show, please take a moment to leave us a review. We surely appreciate it. And be sure to subscribe so that you never miss a new episode. We'll see you next week.